Hi everyone, my name is Hyacinth Yvette Alian and I am from Ma'am Beth Pedra's class. Before I start talking about my topic, I just want to ask a question. Have you ever felt extreme sadness that you even lose interest on something which can interfere your daily life? And with this extreme sadness, it affects how you think, how you act. Sometimes you just lay on your bed, not doing anything, not because you don't want to do it, but it's because your feelings way more than what you have to do. And even if you try to do it, you just can't. Sometimes you also don't sleep for days, even if you really want to sleep and your body is really tired, but your mind won't stop you from thinking many things. At times you also want to die but don't know how to do it. You also try to think of the way how you will end yourself, but thankfully you are still alive and kicking right now. Does it sound familiar? If you are still there, I just want you to know that I'm glad you're still alive. And if you haven't experienced any of this, I thank God that you didn't. A research was published recently, June 17, 2021, from World Health Organization. They said that more than 700,000 people die due to suicide every year. For every suicide, there are many people or many more people who attempted suicide. A prior suicide attempt is a single most important risk factor for suicide in the general population. Suicide is the fourth leading cause of death in 15 to 19-year-olds. People die from suicide because of depression. And clearly, depression is also a disease, just like the others. And a disease will always be a disease. By learning about depression, our knowledge can be widened and we could help people within our reach to keep their homeostasis. We all know that depression is a mental health disorder, but most people are not aware about its anatomical and physiological changes, because when a person is experiencing depression, we wouldn't know unless they speak or share about it. And unlike other diseases, people find it hard to believe when someone is depressed. The purpose of my presentation is to share with you guys the anatomical and physiological changes of a person when she is diagnosed with depression. But before that, let's learn what really is a disease named depression. According to American Psychiatric Association, depression or major depressive disorder is a widespread and significant health condition that has a negative effect or negative impact on how you feel, think, and function. It is also, thankfully, treatable. Depression produces unhappiness or a loss of interest in previously appreciated activities. It can cause slew of mental and physical issues, as well as a reduction in your capability to operate at work and at home. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, weight loss or gain unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity, for example, inability to sit still, pacing, hand-wringing, or slowed movements or speech. These actions must be severe enough to be observable by others. Also, feeling worthless or guilty, difficulty thinking, concentrating or making decisions, and lastly, thoughts of death or suicide. According to medical news today, the symptoms vary between individuals and may change over time. For a doctor to diagnose a depression, a person must have 5 or more symptoms that must be present during the same 2-week period. The effects of depression in the body includes insomnia, headaches, fatigue, chronic pain, increased risk of heart disease, weight loss or gain, nausea, diarrhea, constipation, loss of libido, dyspareunia, and inflammation. Research has documented many ways that depression can affect physical health or the anatomical and physiological health, including this. Number 1, weight gain or loss. People with depression may experience appetite changes, which can cause unintended weight gain or weight loss. Medical experts have associated excessive weight gain with many health issues, including diabetes and heart diseases. Being underweight can harm the heart. This can also affect fertility and can cause fatigue. Number 2, chronic pain. People with depression may experience unexplained aches or pains, including joint or muscle pain, breast tenderness, and headaches. A person's depression symptoms can worsen because of chronic pain. Number 3, heart disease. Depression can reduce a person's motivation to make positive lifestyle choices. The risk of heart disease increases when they eat a poor diet and have a sedentary lifestyle. Depression may also be an independent risk factor for heart health problems. According to research that was published in 2015, 1 in 5 people with heart failure or coronary artery disease has depression. Number 4, inflammation. Research indicates that chronic stress and depression are linked to inflammation and may change the immune system. Other research suggests that depression could be due to chronic inflammation. People with depression are more likely to have inflammatory conditions or autoimmune disorders such as irritable bowel syndrome or IBS, type 2 diabetes, and arthritis. However, it is unclear whether depression causes inflammation or chronic inflammation makes someone more vulnerable to depression. More research is necessary to understand the link between the two. Number 5, sexual health problems. People with depression may have decreased libido. They also can have trouble becoming aroused. They can also no longer have orgasms or have less pleasurable orgasms. Some people also experience relationship problems due to depression, which can have an impact on sexual activity. Number 6, worsening chronic health conditions. People who already have a chronic health condition may find their symptoms became much worse if they develop depression. Chronic illnesses may already feel isolating or stressful, and depression may exacerbate these feelings. A person with depression may also struggle to follow the treatment plan for chronic illness, which can allow the symptoms to get worse. People who experience depression and who have a chronic illness should talk to a doctor. They must talk about the strategies for addressing both conditions. Preserving mental health may improve physical health and make a chronic condition easier to manage. Number 7, trouble sleeping. People with depression may experience insomnia or trouble sleeping. This condition can leave them feeling exhausted, making it difficult to manage both physical and mental health. Doctors link sleep deprivation to a host of health problems. Similarly, research has correlated long-term sleep deprivation with high blood pressure, diabetes, weight-related issues, and some types of cancer. Number 8, gastrointestinal problems. People with depression often report stomach or digestion problems such as diarrhea, vomiting, nausea, or constipation. Some people with depression also have chronic conditions including IBS. According to research that was published in 2016, this may be because depression changes the brain's response to stress and suppressing activity in the hypothalamus, pituitary gland, and adrenal glands. These are the list how to avoid depression or how to treat depression. But if you are experiencing or your friend is experiencing depression, it is much better for her to see a doctor because the doctor knows better on how she would handle the patient. Okay, so moving on, many people take medication for depression, such as antidepressants, but various natural methods can also help manage symptoms and reduce the risk of future episodes. Depression can occur at any age and it can affect anyone. But according to National Institute of Mental Health or NIMH, people are more likely to experience it if they, number 1, have a family history of depression, number 2, have experienced trauma, stress, or a life-changing event, number 3, have a physical illness such as cancer, number 4, are using certain medications or other substances. These are the following tips for people who have risk factors or who are living with depression, manage or avoid symptoms. Number 1, avoid stress. There is evidence of a link between stress and depression or anxiety. People who have susceptibility to depression may have a higher risk of developing it if they have chronic illness. Some people are born with genetic factors that increase their risk, or others may develop susceptibility during childhood, for example, due to neglect or abuse. A 2012 study conducted with veterinary students have found that stress had an adverse impact on mental health, life satisfaction, and general health. It is not always possible to avoid stress, but taking steps to do so may help. These include, number 1, getting enough sleep and rest. Number 2, learning to say no to additional demands. Number 3, taking breaks from work. Number 4, practicing breathing exercises and meditation. And number 5, getting regular exercise. Always check with a doctor before taking any supplements or over-the-counter medications to ensure if it's suitable for use. Number 2, exercise. Research shows that physical activity can act as an antidepressant, and experts encourage doctors to include it as a treatment. Number 3 is diet. A healthful diet may help prevent depression and boost mental health well-being. A 2019 study concluded that dietary interventions could play a role in treating depression. Research also suggests that these following foods may help. These are fresh fruits and vegetables, green tea, soybean products, healthful oils such as olive oil, whole grains, and fish. At the same time, people should limit their intake of this following: red meat and meat products, pre-made baked goods, trans fats, and sugary desserts and sodas. Fresh fruits and vegetables provide antioxidants. This help protect the body from oxidative stress and cell damage. According to an article in antioxidants, processed foods may adversely affect gut microbiota, which could increase risk of depression. Number 4, sleep. According to an older article, there is a strong link between depression and insomnia. A lot of depression may worsen symptoms of depression, and it is also a common symptom. Number 5, alcohol and drug use. The use of alcohol and some recreational drugs can increase the risk of depression and could also make the symptoms worse. Many people have depression or have both depression and drug use disorder or alcohol use disorder. How the disorders affect each other, however, it is not always clear. A person who uses drugs or alcohol in an unhelpful way and has depression may need help for both conditions. Anyone who has concerns about alcohol or drug use with or without depression should speak to a doctor or another specialist who can help. Number 6, talking therapy. Psychotherapy or talking therapy can help people identify the causes of depression and find practical solutions. That is why if you are having or experiencing depression, it is much better for you to see a doctor, because relying on these tips may not help you very well. It could help you, but it is much better if you will talk or go to a therapist, because the therapist will know about how you will deal with your depression personally or uniquely. Psychotherapy, it also have options, and these options include counseling for specific issues such as bereavement. Number 2, cognitive behavioral therapy or CBT, which can help a person find new ways of thinking and acting. And number 3, psychoanalysis, which often looks into past issues. Therapy can be one-on-one with a group of people who meet just for therapy, or with partners or family members. Number 7, avoid common triggers. Various factors can trigger symptoms of stress and depression, and this will vary between individuals. It may be possible to avoid or reduce exposure to some of these triggers. Triggers that a person may be able to avoid include exposure to news, some movies, and other media, using alcohol or drugs unless the person has a related disorder, and having too little sleep due to late nights. If avoiding triggers is not an option, it may be possible to reduce exposure, for example, by deciding on one specific time of the day to check emails and watch the news. There is no guarantee that anyone can avoid their triggers, but being mindful about them or being mindful about your specific triggers may help find ways to minimize their impact. It is not always possible to prevent or avoid depression, but effective treatment is available, and some lifestyle choices can help manage symptoms and prevent recurrence. If symptoms of depression are overwhelming, or if a person is thinking about self-esteem, death, or suicide, they should talk immediately or should seek immediate medical attention. That's all for today. Thank you for listening.